Hey, future doctors! Welcome to our guide on NEET Pg preparation. I know how overwhelming NEET Pg can feel, but don't worry, we've got your back. Based on previous year's papers, we've compiled high-yield topics you can't miss. Think of this as your roadmap to NEET Pg success. Let's get started. Let's kick things off with anatomy, the foundation of medicine. Brachial plexus, know it like the back of your hand. Cranial nerves, your best friends. Don't neglect upper limb joints and muscles or lower limb nerve injuries. Lastly, brush up on histology. Tissues, cells, the works. Next up, we're diving into physiology. This is where things get interesting. First, renal physiology, then the cardiac cycle. The heart is the engine. Understand its every beat. Respiratory physiology is crucial, how we breathe, exchange gases. And don't forget the CNS, the brain and spinal cord, the command center. Time to get our chemical romance on with biochemistry. Enzymes catalyze reactions, speeding things up. Metabolism, how our bodies utilize energy. Vitamins, essential nutrients we need. Know their functions and deficiencies. The genetic code is the blueprint of life. Connect the dots with clinical correlations. Pathology, unraveling the mysteries of disease. Delve into the nitty-gritty of disease processes. Inflammation is a key response to injury. Neoplasia carcinomas, crucial for NEET Pg. Hematology covers blood disorders from anemia to leukemia. Immunopathology, your immune system's defense. Pharmacology, your prescription for NEET Pg success. Learn about the medicines we use to treat diseases. Autonomic pharmacology covers the fight-or-flight response. CNS drugs are heavily tested on NEET Pg. No antidepressants, antipsychotics, antibiotics are weapons against bacterial infections. Know their mechanisms and spectrums. And don't forget adverse drug reactions. Medicines can have unwanted side effects. Microbiology, the microworld, macro importance. Zoom in on the tiny but mighty world of microbiology. Bacteriology covers bacteria, their shapes, sizes, and diseases. Virology is about viruses, those sneaky intracellular parasites. And lastly, let's not forget immunology basics. Your immune system's battle against microbes is crucial. Forensic medicine, the CSI of NEET Pg. Time to put on your detective hats for forensic medicine, where medicine meets the law. Types of injuries, from blunt force trauma to gunshot wounds, know how to identify them. Poisoning is big. Know the common poisons, their effects and treatments. And lastly, thanatology, the study of death and dying. Chapter 8, Social and Preventive Medicine, SPM. Public Health Powerhouse. Let's talk public health, people. Social and Preventive Medicine, SPM, keeps populations healthy. Epidemiology is key, understanding disease patterns and outbreaks. Vaccination schedules, know them by heart. National health programs. Be aware of initiatives to improve public health. Medicine, the heart of NEET Pg. Medicine is where everything we've learned comes together. ECG interpretation is a must-know skill. Rheumatology covers joints, muscles, and autoimmune disorders. Neurology studies the nervous system, from headaches to strokes. Infectious diseases include bacteria, viruses, and parasites. Chapter 10, Surgery, Scalpels, Sutures, and NEET Pg success. Time to scrub in for surgery. This is where things get hands-on, at least in theory. Hernia, a common surgical condition you need to know. Burns and fluid management, crucial for burn victims. Finally, shock trauma management. Stabilize and treat critically injured patients. Let's talk about the circle of life, NEET Pg style. Obstetrics and gynecology is all about women's health, pregnancy, and childbirth. Antepartum care, managing pregnancy from conception to labor. Preeclampsia, eclampsia, serious pregnancy complications to recognize and manage. Contraceptives, different family planning methods. And lastly, menstrual disorders, from irregular periods to endometriosis. Pediatrics, get ready to think like a kid again, or at least like a doctor treating kids. Developmental milestones, know those growth charts well. Neonatal resuscitation, saving lives from minute one. And lastly, genetic syndromes, from Down syndrome to cystic fibrosis, you need to recognize these conditions. Let's talk radiology and psychiatry. Radiology uses imaging techniques to diagnose diseases. X-ray findings reveal a lot. Previous year question included many questions from radiology. Never skip any topic from it. CT, MRI. Advanced imaging for a closer look. Psychiatry delves into the complexities of the mind. Drug profiles in psychiatry. Medications used to treat conditions. That's a wrap on the essential topics for NEET Pg preparation. We've covered a lot of ground, but remember, consistency is key. Focus on high-yield areas, practice MCQs, and stay motivated. You've got this. Don't forget to like, share, and subscribe for more content. Do watch out the quick daily quiz series. We're all in this together, and I'm here to support you every step of the way. Now go out there and ace that NEET PG.